Hi and welcome back. We're now in personality disorder looking at part 3 and looking at what is now treatment. Therapists from different schools of therapy try to assist people with personality disorder to gain a better awareness of their self-defeating behavior and to learn more adaptive ways to relate to others. Despite the difficulties of working therapeutically with these clients, promising results are emerging from the use of a relatively short-term psychodynamic therapy and cognitive behavior treatment approaches. So let's start with the psychodynamic approach. The psychodynamic approaches, they have promising results, have been reported using structured forms of psychodynamically orientated therapies in treating personality disorders. Looking into the past experiences for roots of self-defeating behavior is one aspect. These therapies raise clients' awareness of how their behaviors cause problems in their close relationships. The cognitive behavior approaches, behavior therapists see that their tasks as changing clients' behaviors rather than their personality structures. They focus on attempting to replace maladaptive behaviors with adaptive behaviors through techniques such as extinction, modeling, and reinforcement. Two groups are shown to have some success. One is by Beck, where he helps correct cognitive distortions, supporting either an all good or all bad sense of self. Lynham, he used what is known as dialectic behavior therapy, or DBT, a combination of behavior therapy and supportive psychotherapy. Now you'll see in your e-text an acronym called IMPROVE. It's at 6.3.2, I believe. Okay, and that gives you an example. Biological approaches, we can group them as being drug therapies. Drugs do not alter the long-standing patterns of maladaptive behaviors that may give rise to distress. However, antidepressants of the selective serotonin reuptake inhibitor class, an example of that is Prozac, can reduce aggressive behavior and irritability in impulse and aggressive individuals with personality disorders. Now, at Canadian Treatment Services, we play a role. Because of the diversity of the problem associated with personality disorders, no single therapy modality works with all patients. Added to this are the cost containment constraints on mental health services across Canada, and the need for service delivery mechanisms that must be comprehensive and flexible, yet efficient and effective. The following is what you'll see as the premise, and you'll find these in your textbook as well. The first, psychotherapy, to reduce extremes of maladaptive behavioral patterns and bring to the patient's attention. The second is a historical perspective of maladaptive behaviors to be gained. The patient then sees the pattern over time from past experience to current times. And then 3, skills to practice the alternatives and more adaptive behavior patterns. Those sorts of strategies tend to have some of the best effect in the long run, but personality disorders are really difficult to treat. So I hope you're gaining some good insight, but I hope you're also starting to get some understanding that the simplicity of abnormal behavior is just not that simple. It's much more complex. All right, everybody. We're done on personality disorders, and we'll see you next week. Bye now.